Hello everyone, welcome back to Medi Notes for Medicos. The topic that we're going to deal today is inflammation from pathology. The objectives are introduction, pathogenesis, the causes, classification, acute inflammation, morphology of the acute inflammation, chronic inflammation, and the morphology of chronic inflammation. So what do you understand by inflammation? If you see this picture over here, you can see a reddish sort of edema or sort of rash formation over here. This is an example of inflammation. What happens over here is when our skin, our body gets exposed to agents that the body doesn't recognize, they respond to it by the vascular tissue, they respond to it and they deliver this leukocytes and molecules of the host defense from the circulation where the site of infection or the cell damage has occurred. Why? Because they don't want this noxious agent or the harmful agent to enter the body. They want to eliminate it then and there itself. So this inflammation process occurs. So how does this inflammation process occurs? What happens is that there is this entry of noxious agents or unwanted agents inside the body. So this tissue has resident sentinel cells, no, like macrophages, dendritic cells, and mast cells that recognize this noxious agent and they initiate the stimulus. Once the stimulus is initiated, the receptors they start engaging and starts producing mediators of the inflammation. Once the mediators is released, they start recruiting the leukocytes and plasma proteins into the tissues from the circulation to the extravascular site where this noxious agent is located. Then this leukocytes, plasma proteins, they all go and ingest and cause destruction of the microbes and dead cells by the phagocytic cells. Uh, and then there is this removal of the stimulus of the inflammation, after which the response, that inflammation process, it starts getting regulated. Once the regulation is occurred, we now the body focuses on repair mechanism. So what they do is they replace this injured tissue by the help of regeneration of the survival cells, and the connective tissues that has been affected is filled, and then the scarring occurs, then the repair occurs. So what might be the causes of inflammation? It can be infections that is caused by bacteria, virus, fungi, parasites, or it can be caused by microbial toxins. Infections is the most common cause of inflammation. Then tissue necrosis. It doesn't depend on which sort of cell death has occurred. The cell death would initially cause the inflammation to occur. Then the foreign bodies, like we all know, splinters, dirt, sutures, this elicit the inflammation by themselves or because they cause traumatic tissue injury and or carry microbes with it. Endogenous substance, for example, urate crystals in gout, cholesterol crystals in atherosclerosis. Immune reaction, this is also known as hypersensitivity. They actually have a normal protective immune system, but what happens, this immune system, they attack their own individual system and this might cause autoimmune diseases. Now, what are the classifications? Inflammation are having two sorts of classification. One is acute inflammation, the other is the chronic inflammation. So, what is an acute inflammation? Acute inflammation isn't just based on the duration of the inflammation, but actually it is a rapid or often self-limited response to the noxious agent that are readily eliminated. This might take seconds, minutes, or hours to develop. It's of short duration and it is characterized by the exudation of fluids and plasma proteins, that is edema, and the immigration of leukocytes, predominantly neutrophils. And the reaction, it subsides as soon as the offending stimulus is eliminated and the residual injury is repaired thereafter. So what are the morphology that we see in acute inflammation? We can see dilation of small blood vessels. We can see the accumulation of leukocytes and fluid in extravascular tissue. We can see skin blister. We can see production of pus, that is in acute appendicitis cases, ulcer, for example, in peptic ulcer. What is chronic inflammation? Now, after this acute inflammation, sometimes what happens is unresolved cases occurs of acute inflammation. For example, the peptic ulcer. It might also follow the acute inflammation, or it might suddenly arise without having an acute inflammation. For example, the response to tubercle bacilli are difficult to eradicate, and this occurs for a longer duration. It is associated more with scarring and destruction. So what are the morphology of this chronic inflammation? We can see infiltration with mononuclear cells. So what are the mononuclear cells over here? Macrophages, lymphocytes and plasma cells. Destructed tissues are seen, proliferation of small blood vessels and fibrosis are seen. So that was it for today's video. I hope you like this video. If you like this video, don't forget to like, share and subscribe to the channel. We'll be coming with more videos. Till then, stay tuned. Happy learning. Bye.